goal for the Queensland Genomics program was to accelerate the adoption of genomics into everyday care for Queenslanders. With our partners, we worked on fast-tracking the way to personalised medicine by connecting our health system and consumers with genomics research. The program was designed to invest over 3 funding rounds in clinical activity, in building our health system and engaging our community, all at the same time. With new technology comes new challenges, and we worked with our partners on clinical projects to find solutions. We considered workforce issues, health economics and sustainable funding, how we build diagnostics capability here in Queensland, the ethical and legal implications of new technology like genomics, and considerations for our electronic medical record. We established a community advisory group and supported them to be active participants in the genomics program. Throughout the program, we invested in a range of disease areas that were genomics ready, including cancer, neurology, renal disease, cardiac health, and infectious disease. Because there were genomics groups in other jurisdictions that have similar goals to us, we had opportunities to learn from others' approaches. The most important lesson we learned was to play to our strengths, using translational research to build on Queensland's health system.
Queensland's health system has a number of unique characteristics that were relevant to the design and delivery of the Queensland Genomics program. Some examples of the strengths of the system includes a statewide pathology service, a statewide children's health service, genetic health services for Queensland, our digital health system. And these characteristics were critical to how the program could be delivered so that we could leverage those strengths. When we were designing and implementing the Queensland Genomics program, we were able to work with the key groups across Queensland that had responsibility for these systems. So for example, we were able to work very closely with Pathology Queensland to understand how they could be a key player in the rollout of the genomics program. So this included making investments with that group and understanding how best to apply them to the challenges that genomics faces in the health system in terms of how the diagnostics capability would work, how we would interact with clinicians and scientists, and importantly how we would understand the sustainability of these services for Queensland's health system.
The Queensland Myeloid Genomics project has been a pilot program run across all of Queensland hospitals aimed at understanding and improving prognostication of patients with myeloid malignancies. Essentially over the last 2 years we've been able to sequence the DNA of patients affected by myeloid malignancies to better understand how they may behave and how we can better treat them. Myeloid malignancy is a common blood cancer that affects over 3,000 people a year in Australia, and we've been able to sequence over 220 patients, children and adults from all corners of the state.
The great power of whole genome sequencing is that you can look at the entire length of a bacterial genome and you can compare that genome to another genome. And from that you can essentially say whether these two bacteria are identical, or very closely related, or very distantly related. And that starts to help piece together the transmission network of outbreaks that you are tracking. And we've certainly seen this recently, as you know, with COVID, but this can be applied to essentially any infectious disease that has a pathogen that you can sequence.
So we do all of the genetic testing here, anything from very small tests up to really large complex tests, which are the ones that Queensland Genomics has helped us to build over the years. One of the critical things that we really need to do when moving into diagnostic genomics is to start to engage better with our clinicians. They're the experts in the diseases, whereas we're the experts in the diagnosis of the molecular cause of those diseases, and they really work hand in hand. And so what we're doing now with all of these projects is we go through the data with the clinician. What happens at the end of that process is then we take the information and the report back to a multidisciplinary team meeting where we have the original treating clinician in primary care as well as the specialist clinician, and we're able to talk together and make recommendations about the care of that patient and what we might do next if we don't have a diagnosis.
It's important to have consumers involved, engaged in a co-design capacity from the research, design, ideation stage, right through the delivery of services and across the state.
Queensland Genomics had a business case and program design that was established from the outset of the program. That included this very important concept of concurrently running clinical program and a capability program, as well as understanding the role that community would play in the rollout of genomics in Queensland.
I think really one of the successes that we see of this group is that everybody felt that their voice was valued and everybody felt that they had something to contribute, and they really felt a true collaboration in this group. And I think that that is ideally what consumer advisory groups are trying to achieve. We are always trying to achieve co-design and collaboration, and I think we actually nailed it with this one.
Before we could start offering this test, a significant amount of work needed to be undertaken by a number of groups to make this feasible. Importantly, Pathology Queensland had to develop a testing platform that could offer complex next-generation sequencing of over 37 genes involved in myeloid malignancy.
Pathology Queensland, with the support of Queensland Genomics, has been able to implement 2 next-generation sequencing-based panels for leukaemias. The tests are already benefiting patients across Queensland. We are partnering with a lot of the clinical units across the state, and patient recruitment is happening every week, and they're being discussed in multidisciplinary meetings every 2 weeks, and it's already contributing to patient care.
So traditionally we would do single gene tests by the technique Sanger sequencing, whereas now we're accredited for whole exome sequencing, whole genome sequencing. So we're able to look at all of the genes in a genome, and in fact all of the nucleotides in a genome all at once now. And what that means is that data becomes a lot more powerful. We're able to make more diagnoses.
Since we've introduced this outbreak response system, we used to have regular outbreaks at some of our large hospitals every year or a couple of times a year that we would have to deal with. We haven't had a single large-scale outbreak since we've introduced this program. And I think very much this is because we're able to spot these early on, nip it in the bud, institute whatever measures we need to, and target them much more precisely. We've had a team of infection control nurses who have been integrated within the project for a period of time and have a good, deep understanding of what we're doing in the laboratory, what the bioinformaticians are doing, how our pipelines work, and then can help translate that to clinical action.
The clinical program really gave us the sort of evidence that we needed to understand how those core capabilities would be developed. The capabilities that we worked on included ethics, legal and social implications. It included factors of the workforce and how we would develop that workforce. It included areas around health economics, which allowed us to build evidence for sustainable funding of clinical activity. It also let us look at the nature of the data and the digital environment that results from genomics information. We took a very strong focus on the legacy that the program would leave in terms of the return on investment to the system. It was critical that the $25 million resulted in a stepwise change for the system, but also beyond the program enabled Queensland Health to make better planning decisions, create policy and make decisions on further investments.
So I would very much hope that by the time this project's finished, we can essentially transition seamlessly from what's been, I guess, primarily a clinical research project to something that is business as usual, that is integrated within the normal work of our laboratory. And then we can build on that expertise, build on that infrastructure, build on that knowledge and experience to expand that testing to other areas of healthcare.
So, where do we go from here? Closing this program has encouraged all of us to think about the future. It's clear genomics in healthcare must be guided by a strong policy position. Queensland Health is developing this policy framework to help us make good decisions and guide the focus for precision healthcare in our state. These next steps will mean the ideas and capability we've generated through the Queensland Genomics program paves the way for success in the future.